Good evening and welcome to the Pitt County Board of Health's monthly meeting. I'd like to ask, are there any public comments to start the meeting? Okay, hearing none, let's move on to the minutes of the January meeting. Are there any corrections or additions to the minutes?
Move to approve the minutes.
Second.
Motion made and seconded to approve. Any further discussion? All in favor say aye.
Aye.
Any opposed? All right, the minutes are accepted. We'll move on to fiscal report. Marcia Hall.
Good evening, y'all. Just wanted to get your attention at our January period 7 report. Our first 3 columns reflect the approved budget, and there were no changes for the month of January. Can you hear me? You can hear me now? Okay. Our fund balance is currently $1.1 million. And moving on into the 5th column for the year-to-date results in January, you will see that our revenue is slightly down for January in our clinic and also with our environmental health areas. We can contribute some of this to the 2 holidays in January and also the 2 days of closures for snow and ice. And the environmental health on-site visits are weather dependent, so we're contributing that decrease to the weather. Our year-to-date column, if you scrolling down, sorry, you will see that in January we have a deficit of around $359,000. But if you see the next column over, if you will take into consideration of the timing items such as the 2017 Medicaid cost study, the county funding, and the state expenses for January, we should have a surplus of around $308,000. Also, we would like to let you know to be expecting in next month's financial report, we should be receiving $40,000 from the 2014 Medicaid cost settlement. And you will find out more about the Medicaid cost settlement on Saturday when we talk about Medicaid reform and how that may or may not look in the future. Our Epic Go Live date is scheduled for April the 10th, and our Epic dress rehearsal is scheduled for Tuesday, April the 3rd. We're super excited about this. Our training starts mid-March at Vidant with our different areas. Our business office, registration, and clinic areas will be in the trainings. They'll be staggered, but we will be expecting some of our revenue to dip a little bit during that month because our walk-in hours are going to be a little bit shorter just so we can get the technology in place and the training in place. Last week we paid Vidant the $182,000 for our provider licensing for Epic. We will have some additional costs for computers in the clinic room, data drops, communication contracts such as Televox, and our credit card processing. We will be moving to the Vidant credit card company called Renaissance. So we'll have some more additional costs, but we are very excited about the new technology and how it's going to change our workflow. Do I have any questions?
All right. Well, that sounds great. It's been a long journey getting that, getting all set up on Epic. So my hat's off to Tamara and your entire staff in moving this forward.
Yeah, we're excited.
Yeah. Anybody have any other questions? Is there a motion to approve the budget as presented?
Second.
Second. Any further discussion? All in favor say aye.
Aye.
Any nays? All right, budget's approved. Thank you very much. Okay, under old business, our first item is going to be influenza update, and Dr. Morrow is going to present that.
Okay, good evening, everybody. I wanted to bring everybody up to date on what's going on with the flu. I know everybody's heard a lot about the flu through the media recently, but this is an outbreak unlike what we've seen in prior years, and I'm afraid we're not to the end of it yet, unfortunately. This is the report that we got from the, and I'll just preface these remarks. All of these slides I've got from the state public health department or from our local public health epidemiologist at our hospital. This is the report that came out last Thursday, and it shows the flu seasons for the last 3 years, 2015, 16, 16, 17, and in the red is the 17, 18. You can see that we got an earlier increase back in December, early January. This rate started going up with influenza. We were one of the last states in the country actually to get influenza. And it closed in from all sides of North Carolina. So Virginia, Tennessee, and South Carolina were both, or were all, before they had widespread activity before we did. And then the western part of the state had widespread activity before the eastern part of the state. So we were one of the last places to get flu in the country. And I mention that because I think we'll probably be one of the last places to get rid of it also. So if you've been watching the national news, you know that the number of deaths is alarming. The number of hospitalizations also alarming. Concerns about shortages of influenza vaccine in some places, shortages of Tamiflu. There should be plenty of that. It's just a matter of the distribution, I think, but some places have run out for at least short periods of time. We do have flu vaccine here, and I've talked to folks at the medical school today, and they have not been having trouble locally getting Tamiflu, so that's good news. But we are seeing significant hospitalizations still. We've got outbreaks occurring in facilities like long-term care facilities that have restricted visiting, and just like the hospital has done to try to cut back on the transmission. I just mentioned too that it's important that you remember that individual cases of flu are not reportable to public health. So the way we know about what's going on with flu is through surveillance systems, looking at influenza-like illnesses and looking at hospitalizations and deaths. Outbreaks of flu, like at a nursing home facility, are reportable. So we do find out about those outbreaks just as we would with other outbreaks. But this is a high number. Dr. Ramsey and I were just talking about. We don't remember seeing over 9% influenza-like illness for some time, at least. So, and I'm not sure that we've gotten to the top of this curve yet. So, just very concerned about what we may see here in Pitt County in terms of continued illnesses and hospitalizations and deaths. This is from the two surveillance systems that we use in public health. One of these is the Hospital Emergency Department visits. That system is called NC Detect, and it's a pretty unique system. We have over 100 emergency rooms across the state of North Carolina that we can look at influenza-like illnesses in the emergency departments on a day-to-day basis. So that's where that data is coming from, and that's the black line on the chart that you're looking at. The other one is our influenza-like illness network, and that is made up of outpatient providers such as local health departments, college infirmaries, as well as pediatricians' offices across the state and some other private providers across the state. So we're fortunate here in Pitt County. We have 3 of those with ECU Infirmary, ECU Department of Pediatrics, and our local health department all doing surveillance for the ILI net. But again, alarming rates of increases that we're looking at. So this is what's going on from the isolates from the State Laboratory of Public Health. Now, I remind you that these are just the cultures that are sent to the state laboratory. This is not any indication of the number of flu tests that are done. A lot of these flu tests are done in private practices, offices, or other clinics, and they're using rapid tests that give you a result in about 20 minutes. None of those results do we have data on. So these are the results of the cultures that are sent to the public health laboratory. They run a more extensive testing, I would say a more sensitive testing on those specimens, and then they can forward those specimens on to the CDC for additional subtyping if necessary. But the important thing here, I think, is that you can see that the number of new positive results in the left-hand column, the predominance is still in the type A, H3. We think it's most likely H3N2 is what's been reported across the country for most of this outbreak. But we are seeing both B. Victoria and B. Yamagata also being seen across the country too. And as well as some H1N1 flu also. There's a concern in the last couple of weeks about people in their 40s and 50s dying from H1N1 type A flu. So we've just got a whole lot of flu. North Carolina, so far, this figure jumped up last week to 140, the total number of deaths just in North Carolina. The week before this, it was 95. So it jumped up significantly, and you can see that there were 34 deaths in that last week of reporting, which actually goes back into January. So you can see we're a little bit behind here in terms of when we get this data. So we'll get data this Thursday. A new report will come out, but it will be for the week prior. So it's running about a week and a half behind, basically, is the data that we're getting. And I just point out that the 140 deaths, they start that season October the 1st, but as y'all know, the flu season is not nearly as well defined as it used to be. It does occur in the winter still, but we're seeing flu cases virtually year-round, and that's why it's so important for folks to stay vaccinated every year. But 34 of those deaths occurred in that last week, so we're still concerned about the death rate. I think I skipped one slide. There you go. So when you're looking at those 140 deaths, this is how they break down age-wise. You can see predominantly over 95 of those were in the age 65 and older, about 35 in the 50 to 64, and then fewer in the younger age groups. We did have an additional child death as of the last report. I think there are 4 now currently in the state of North Carolina. There are pediatric deaths, which include from 0 up to 17 years old. And this is our local Vidant Medical Center breakdown, and this is from our public health epidemiologist, Bill Cleve, puts this report together for us every week. And you can see this report goes up to February the 10th, so it's just 3 days ago on this one. But the dark blue is your type A influenza, and you can see how that has increased going back to around Christmas, but drastically increased here in the last few weeks. The light blue is the type B flu, and that's also increased. If you look back before Christmas, you can see there's a lot of red in that graph, and that is respiratory syncytial virus, which causes some flu-like symptoms, but is not as deadly as influenza. And then you've got the other cold viruses like coronavirus, rhinovirus, enterovirus, adenoviruses, and metapneumovirus is another one that we've seen. But the big one there, you can tell this is the testing that's done at our hospital, and you can see that influenza A is the major concern there. So that's my report on flu. I'd be glad to answer any questions you may have.
Of the deaths that we've seen, were they people that were vaccinated?
That's a great question. Were some of the deaths in vaccinated patients, absolutely, and that's been reported across the country. So, and I had somebody ask me the other day, and they actually used it as an excuse not to get a flu vaccine because they said most of the people who died had the flu vaccine. Well, most of the people who died, as you can see in this slide here, are elderly folks, and often those folks have complicating medical illnesses. They're at much higher risk of severe complications from influenza. So, yeah, the flu vaccine, the effectiveness right now is not as good as we'd like it to be. They think it's probably going to be around 30% this year. It was about, I think, 35 is what the CDC reported last year. But I have to say that I think we probably use a lot of things in medicine that don't have 30% effectiveness. And if somebody tells me that if I give you this medicine, you got a 30% chance of not dying, I think I'm going to take it because that's pretty good. And that's the best thing that influenza vaccine does is it protects the severe reactions like hospitalizations, intensive care unit, and deaths. But it by all means is not perfect, and people still can get vaccinated and still get flu and still die as a result of that flu. But it's still the best protection that we have is vaccination. And I certainly encourage anyone who's not been vaccinated, even today, to go get a vaccine as soon as possible. I take the vaccine myself. I give it to everyone in my family because I want to protect them. And I think everyone should do the same.
Does the vaccine, if you get it and the patient still gets the flu, does it still help with maybe the symptoms of duration as well?
It does. I don't know if our audience heard that. The question was, does the vaccine help with the symptoms and the duration of the illness? So it does. The vaccine, I always have to remind people, the vaccine it's not like an antibiotic. It works with our natural immune system. So it's a very natural response, if you will, more natural than taking vitamins or other medications. It stimulates your immune system to protect your own body from influenza. That's how it works. And that's why it takes about 2 weeks to get that maximum protection because your immune system has to build up those antibodies. That's not something that's passively given you in the shot. You're just stimulating that immune system to boost your own immune system. So taking the vaccine, as soon as you take the vaccine, your immune system begins to fight that infection and defend itself against that infection. That maximum protection takes at least probably 2 weeks. In the elderly, their immune systems don't work as well, so they don't get as good of immune response. That's why we have a high potency vaccine available for the elderly, because it stimulates a better immune response. And then in some children, you don't get as good a response. So, and if you have different, problems like cancer and things, you may not have the good immune response that a healthy person might have. So all of those things come into play, but it does start protecting you as soon as you take it. It just takes it a while for your immune system to build that antibody response up. Great question.
Very good. Any other questions? Thank you very much for the update, Dr. Morrow. Okay, our next item is the EWIC program, and Robert Tand is here to update us on that.
Well, good evening, everyone. My name is Robin Tant, and I'll be presenting this evening about some updates for the WIC program. Just as a reminder, WIC stands for the Special Supplemental Foods Program for Women, Infants, and Children. So again, just an overview. WIC is a federally funded program by the USDA, the United States Department of Agriculture. It's a supplemental program that began in 1973 for pregnant and postpartum women, infants, and children up to 5 years of age. There is an income eligibility as well as a nutrition risk eligibility that people have to be at risk for. And then just to kind of overview, the WIC program is considered a nutrition program. So the 4 pillars of WIC are nutrition education, healthy foods and food packages, breastfeeding support and education, and referrals to health care with immunizations and things like that, as well as other human service type referrals. So there's lots of things that goes on when we have clients that come in for our WIC program. Now, the next thing I wanted to talk about is something really exciting that we're all excited about, and we think our participants are excited about, our staff is excited about, and we wanted to share with you all. So the North Carolina WIC program is moving from a paper-based method of WIC benefit issuance to an electronic benefits transfer system, which is called eWIC. Pitt County actually rolled out eWIC on January the 24th, 2018. Very, very smooth rollout, so we were very happy about that. The system really replaces paper food instruments, which is more commonly known as vouchers, with eWIC cards that are issued at our local health departments, at the health department here. The eWIC program is being rolled out incrementally in North Carolina, and we will roll out 1. The card itself works like a debit card, so when you go to the store and you're in the checkout line, you use it just like you would a debit card, using your PIN to enter. So we try to get our clients to create their PIN while they are with us, so if they have any problems, then they're right there and we can help them out with that. Another really nice aspect of the eWIC program and the eWIC system is the convenience of it. Participants can use their card wherever North Carolina eWIC is accepted. Like I said before, this is the year that we're rolling out incrementally, so we were fortunate to be rollout 1. So everywhere in North Carolina is not doing the eWIC program right now, but they will be by the end of the year. So there's several ways that a person can determine their balance when going to the store. You can do it by the last receipt. You can check the app, which I'll be talking about in just a moment, call customer service. And there's also a shopping list that we print while the participant is right there in the office. The participant can buy only the foods they need when they shop. They can use their WIC food list to check which foods are allowed, or they can use the app, which again we'll talk about in a moment. And another nice benefit to it is they don't have to separate out WIC foods from non-WIC foods with this card. So I thought I would show you a glimpse of an eWIC receipt just to give you an idea of what the participant sees when they go to the store. So we've labeled it number 1, which just shows the WIC foods and non-WIC foods that were bought, so they can tell that. Number 2, in the area number 2, WIC foods currently available to be purchased. Again, like I said, they don't have to purchase everything all at one time. The WIC foods that were purchased just that day. They can also see on number 4, WIC foods that they have left to buy during the month. So really nice features. And on number 5, circled in red, I know it may be a little difficult to see, but that's actually telling the participant when their eWIC benefits run out. So there is a first day to spend and a last day to spend. So once that day goes by, for the last day, they won't be able to use those benefits any longer. It's really easy access. There's an app which is called a benefit app, or they can also log on to www.mybenefit.com. So they can do it either way. And with these 2 things, they can check their current food benefits, which I just mentioned earlier. They can see their transaction history. They can see their future benefits. They can find a store. And some of the other things is they can reset their PIN, they can reset their password. If there's a replacement card or if it's lost or stolen, they can also do those types of things. Before, when we were using the paper system, if the vouchers, the food instruments, again more commonly called vouchers, were misplaced or lost or stolen without a police report, we could not replace those vouchers. But with this card, they can get a replacement card and they can be replaced. So that's also a really nice benefit to it too. And the other thing that we wanted to talk about is the mobile app. So with the mobile app, the participant does need to have a smartphone, so you have to have a smartphone to use this app. But again, it is not the only method that they can use to see what their benefits are. They can use their last receipt, they can use the website, or they can call customer service too. So there's definitely other ways. So I do have a little video clip that I'd like to show you, again, to give you a better idea of what that app looks like. It's really neat. So I'm going to go ahead and go to that.
Benefit is Solutran's easy-to-use mobile app where cardholders can view their WIC accounts directly on their smartphones. All they need to do is download the app from the iOS or Android App Store. Once in the app, cardholders can easily register their card by tapping Sign Up and entering their card number, date of birth, and zip code. Or cardholders can log into an existing account by entering their email address and password. The benefit homepage allows the cardholder to easily view their benefit balance, transaction activity, use the product scanner, the store locator, and update their card status or PIN. Tapping View Benefit Balance displays product subcategories and their corresponding quantity of benefits remaining on the card. Tap the subcategory to view the benefit. Each subcategory may display a featured product to assist the cardholder with their purchase. The transaction history page shows purchases made on the card, benefit deposits, and any adjustments made. Tap the transaction to view details. The UPC scanner can be used at a store to verify whether a product is eligible for WIC benefits. A green banner will display when the product is WIC approved and the cardholder has the appropriate benefits to purchase the item. A yellow banner will display when the product is WIC approved, however, the cardholder does not have available benefits to purchase the item. A red banner will display when the product is not WIC approved. Store Locator can be used to find WIC stores in your area within a 30-mile radius and provides directions to the store that is selected. Card and PIN updates allows the cardholder to status a card and also set or change the PIN on their card. Tap Update PIN. Type the new PIN in the top field and confirm it in the field below. Then tap Update PIN. A confirmation banner will appear that your PIN has been updated. To status a card, tap Update Card Status. You have the option to status your card as stolen, lost, damaged, or place your card on hold. Once you select the status, you can choose whether you'd like to have a replacement card sent in the mail. The flyout navigation at the top of the page allows the cardholder to view and edit their profile settings, such as their email and password for login. Cardholders can also edit their notification settings so they receive push notifications when benefits have been added, changes have been made to their card or account, or any transactions have been made on their card. The Add Card button is used to link another Solutran-supported WIC, SNAP, or Cash card to the current benefit login. If you have any questions, please contact your local WIC office.
Okay. Is there any questions that you all have? Yes, sir.
Are card holders required to show proof of identification when they use the card?
When cardholders come into the office, the local WIC office, they do have to show identification, but at the store, they do not.
So if somebody were to steal a card, they could use the card until the card is essentially canceled or put on hold.
Well, they have a PIN, so they could only do that if they had the PIN number, just like you go to the store and you have a debit card and you enter that.
Okay.
So if they had the PIN, yes, but if they did not, they would not be able to do that.
Okay.
Do they have, the way the bill was, they have a certain allotment of eggs and a certain allotment of other things. Can they switch those at all, or do they have to eat what is their allotment for that particular food?
Well, say for example, if they do get eggs on their food package, if it's there, it may be there, but they don't have to get that.
But they couldn't use it, say, if they like peanut butter.
Well, not for eggs, but say for peanut butter or beans, there are some substitutions that we do. Like for example, with whole grains, like with whole grain bread or tortilla, they get those choices. So they can choose whole grain rice as another option. So there are some things that they can substitute. Thank you.
Go
I
ahead.
was just going to say, this is a really, it's a really great advancement in how we've done WIC, I think. I'm very excited, and I know our clients are excited about this opportunity to do it this way, to walk into a grocery store with those WIC vouchers is for some people it's been embarrassing in the past, and this takes away that stigma with it. WIC is such a great program. You know, it started from USDA, but it really is about getting healthy kids, giving kids a healthy start with good nutrition. So getting pregnant and breastfeeding women and small children eating healthy foods today is it's really critical, I think, to making sure that we have a healthy adult population. So it's been a great program now going back to the 70s, and I think this is just a great step forward with the program.
And like I mentioned earlier, to tag on to what Dr. Morrow was saying, you know, it is a nutrition education program. So with the program, you know, our clients come in and it's tailored for ages, so, you know, 0 to 5 or birth to 5, and then for a pregnant woman and for postpartum women. And we're also checking things like their iron. We're checking their weights. So we're looking at those growth measurements as well as when they come in. Something else really exciting that we hope to see this year is the opportunity for our participants to engage in online training. So that's something that I think technology is going to, and many of our participants use online type things. And so the WIC program is working towards having participants be able to get nutrition education online.
Yeah, I think unlike some other food programs, it really is about education, teaching particularly moms how to cook healthy and eat healthy and exercise and stay healthy and raise their children healthy. And I was thinking, Dr. Hayes, when you asked about the car stealing, I guess the worst thing would happen if somebody stole a car was they might get healthier. But they don't. You can't take WIC and go buy junk food. You can't buy candy with WIC.
No.
It's healthy foods that are going to make people healthier. So.
And that all of the foods, as Dr. Morrow mentioned, all the foods are healthy. So, you know, eggs, beans, low-fat milk, peanut butter, you know, whole grains, fruits and vegetables, which, you know, that came a while back in terms of being entered on the program. So we've had some really significant changes to the WIC program and in terms of foods, but like he was saying too, we also hone into things like physical activity. That's very important with the program, dental health. So there's other things that we teach when we're talking to our participants.
Yeah, Robin, it's also nice at the grocery store to see a sign say WIC eligible on the, particularly the vegetable areas. I don't know when they started displaying that, but I eventually noticed it myself.
And a lot of them have gone to that, so they're not required to do that, but a lot of them do it. So it may not be on every WIC-approved food, but a lot of those that are approved, you do see those signs now, or those labels.
Yeah.
And in the summer, they can get their WIC items at the farmer's market.
Well, they can, the farmer's market's a little bit different in terms of how this will operate. Actually, the farmer's market will still be food instruments, so they'll be the food vouchers. But we have a limited time when we get farmer's market food instruments, and our participants are really excited about that when they happen. In fact, usually it's within the week when we're issued those virtual numbers that they're gone. So we have people calling, and we just tell people, call back. And when we give out of those vouchers, I'm always on the phone calling the state to see if they can reissue us more. But they love those vouchers.
Very good. Does anybody else have any other questions? Well, thank you very much, Robin, for the update, and hopefully you can come back in 6 months or so and give us an update, particularly on the
Absolutely.
e-week
Thank you.
program. Okay, the next item is the Triple P, the Positive Parenting Program, and Lynn Carter is going to present that tonight.
I'm gonna use the mouse. Mouse is over here on the right, I think, Lynn.
Right there. Good evening. Might not have saved the best computer person to the end, but I think they saved the best program, in my opinion. I'm Lynn Carter. I'm a nurse at the health department. Some of you I know. I've presented when we first started this program back in 2012, and I think we're very blessed to still have it in Pitt County. I'm going to go a little bit over Triple P just because it may be some new people here, and if you haven't seen the billboards or been on the website, you may not know that much about it. And then I'll just tell you where we're headed with the state. What is Triple P? It's really just supporting parents doing an approach of raising children in a positive way. It's teaching parents strategies. The difference with Triple P and some other programs that may be out there is Triple P is evidence-based. It's been out there for 30 years. It's in 17 languages. It's all across the world. It probably was a little slower to even get to the U.S., but we know it works. We know it works in different cultures, different environments, different families, because it's just teaching parents strategies, and then parents choose what worked for them. It's a prevention, early intervention approach, and it's a self-sufficiency where you hope that the parent, once they learn the strategy, they apply it to other situations, other children, and we don't want to keep trying to teach them if they've got it. If they get it, we move on. And the fact that it's a multidisciplinary approach, it just means that a lot of people across Pitt County are trained so that we have parenting support where parents go. It's hard after you've worked all day or you've been and your children been in school to go home and go to a class at night. Oops. Let me about that. With the multiple approach, Triple P really just aims to prevent problems in the family, the school, and the community before they arise, and to create family environments that encourage children birth to 12 to reach their potential. They equip parents with the skills they need to be self-sufficient and to manage family issues without ongoing support. This is a quote from Matt Sanders, who's from Australia. He's a psychologist who actually started Triple P because he had a parent in his office with a child having a tantrum, and the parent was so stressed out, had no way to manage it. So he realized that parents need help. Dr. Sanders is now a grandparent and is working on Grandparents Triple P. Triple P is better with a public health approach. The reason being is it just doesn't focus on at-risk families. To be honest, all families can be at risk. Children are not easy to raise. It's made available to all parents. Either by website or by newspapers or whatever information parents need. And it's through natural areas in the community like schools, child care centers, churches, us, the health department. Sorry, guys. Core principles. They look really logical, and they are. They make sense. But when you're in the moment of parenting, you may not always understand or be able to pull it out. A safe and interesting environment. Children need to be safe. They need to be supervised. We need to know where our children are, what they're doing, and who they're with through all ages of childhood. A positive learning environment just means that it's supportive and nurturing. When children come to show something or ask a question, it's an opportunity for parents to teach the child or to help them learn what they need. Children learn by play. Parents need to be engaged and play with their children. Assertive discipline. It's funny when you hit this one because people have a lot of opinion on discipline. If you look it up in the dictionary, it just means to teach. I had not looked it up until I started this program, but it really means to teach. So if we're talking about discipline, we need to think about what are we teaching our children when we use discipline? Are we teaching them the behavior they need to have as opposed to the behavior they're doing? Are we doing more punishment? Children need discipline. They need to learn to follow rules, just like we do as adults. They help develop self-control. It makes them considerate of others. And it teaches them to express themselves and take responsibility for actions. So discipline's good, but it needs to be assertive and it needs to meet whatever the misbehavior was. Realistic expectations. All children are different. All adults are different. This is both for the parent and the child. There is no perfect child. There is no perfect parent. There's going to be misbehavior. 3-year-olds are going to have tantrums. It's how parents handle them. I really didn't know how to handle the one my firstborn had when he beat his head on the floor at 3. But I went to the pediatrician, and he walked me through it. You know, expecting that we're going to be perfect parents and not make a mistake, that's just not realistic. And then taking care of yourself as a parent. Sometimes parents put themselves last. There's a reason why you put the oxygen in first when you're flying. The parent has to be healthy and okay to be able to look after their children. Yay, I got it that time. These are the different ways or modalities that Triple P can be delivered. Individual, one-on-one. We have a lot of people in Pitt County at different agencies trained in that. Large group, which is seminars. I deliver those in Pitt County, and there are several people been trained in Pitt County in large groups. Small group discussions, phone, and then the online. And North Carolina Public Health has provided Triple P online at no cost for parents in North Carolina. It's not free. North Carolina Public Health paid for it. It was purchased. But it's there for parents who, if they want to make a change and they want to learn, it's online and it's easy to use. These are the core parenting skills that are taught. We go through them, and I say taught, when you're talking to parents, strategies have to be taught. This is an example of a slide that I use when I'm doing seminar. Spend time with your child. Well, people think, well, that's obvious. But again, like I was talking earlier, when your child comes to you is an opportunity for your child to learn. Take the opportunity. Spend time with them. Speak nicely. They're going to repeat what you say, and they're going to repeat it how you say it. If you want them to say please and thank you as children, then as adults you need to say please and thank you to them. Chat and listen often. My father always told me God gave me 2 ears for a reason and 1 mouth. But you need to listen to your child. Put your cell phones up, especially in the car. It's a captured audience, and talk to your child and listen. Share your stories, your good stories. They don't need adulthood problems. They're children. They have their own problems. When it talks about being affectionate, everybody's affectionate different. Our family's big huggers. Some people aren't comfortable with that, but it can be a smile, a high five, a thumbs up, whatever works for you and your family. When I talk about descriptive praise, I want you to be specific. I want you to catch your child being good, what you consider as good behavior, and tell them what you like, what they're doing. We always tend to find fault in children and adults, and we're always correcting people. Let's praise people. Attention, incidental teaching, again, if the child is working on a puzzle and they can't figure out how to do it, it's a way that you can help show them how to do it and let them work on it. And the last is get involved in your child's school. There are a lot of different ways for parents to be involved in school. There's ways to email teachers. I realize people work and it's hard to get off work and get to school. But if you're not involved with your child's school, then you don't really know what's going on with them at school. And I'm going to give you one more slide. This slide is actually my very favorite. The next one is prepare in advance. These are ways to prevent problems. If you come to the health department to meet with a provider, you may be there for a while, so you need to bring something for the child to do. You may need to bring water or a snack because we don't have them there. Arrange activities. It's very hard to sit in a doctor's office or a dentist office waiting with nothing to do. Children 2 and 3 weren't meant to sit for long periods of time. Ground rules. How do you expect the child to behave in the grocery store if they don't know the rules and they're not been clearly stated to them? They don't need too many rules. It's hard to follow. Praise good behavior, watch and supervise. Some misbehavior can just be ignored and it'll go away. We call attention to it, it just kind of gets exaggerated. And then it talks about using your voice effectively. Get close to your child, call them by name, get their attention. If they're playing, especially if they're playing with electronics, they're engaged, they're not paying attention to you, they're doing what they do. You've got to call their name, get close, get their attention, and tell them what you need them to do. When I said Triple P was evidence-based, we know that parents do better. They have higher confidence, they have less stress with their families. This is done by pre and post evaluations that have been done all over the world. And you see less undesirable child behaviors. For coercive, less yelling, screaming, hitting, punishments, and then stress and depression. A study in South Carolina that looked at public health and looked at 18 counties, 9 were Triple P, 9 were status quo, and this is what they saw. They saw decrease in child maltreatment, they saw decreased out-of-home placements, decreased ED hospitalizations, and decreased mental health diagnosis. These are the core principles of Triple P. Matt Sanders started out with just the basic core, birth to 12. Now we have teen. We have stepping stones, which is for parents of children with disabilities. Pathways is anger management. Transitions is for parents going through divorce. Lifestyles is for overweight children, elementary children. And your baby Triple P and workplace are still in research mode. This is where we are right now. I don't know how many were here in 2012, but that's when I first, I think, presented to the board about Triple P. And we really didn't know how far it was going to go. So we started out, we were one of the few counties in North Carolina, along with a few in the western part of the state. This is where we are right now. This is where the state wants to be in 2018. This is what we want the community to look like. For Triple P to be a true public health approach for all families, it needs to be in the community. It needs to be saturated. It's well documented that parenting plays a huge role in a child's social and emotional health. It's also well documented that traumatic childhood events affect a child's adult health. Children deserve the right to have a safe, stable home. And we know that if parents get what they need as far as learning the strategies, we know that we'll have positive outcomes. Children are our next generation. Childhood hasn't really changed. Children really haven't changed, childhood has. Children is the same they were years ago. Their childhood's different. So for us to continue and grow, we need to protect children in Pitt County and make sure they have the opportunity to grow up in safe and nurturing environments. Questions?
Anybody have any questions?
Dr. Ramsey's had the
That was
pleasure
an-
of seeing me present, I think, in the past.
That was an excellent presentation. So you came to, I'm not sure how many times you've been to the Medical Center, but I remember your presentation in 2014, I think it was. Are you available to go to organizations? Certainly.
And
make
if I'm
arrangements.
not, I'll find somebody who is.
Okay, very good.
Thank you.
Thank you.
Thank you.
Lynn, did you want to mention anything about this, or?
Oh, that's my heart up there. That's the newspaper. We get about 9,000 to 10,000 in Pitt County. I carry them everywhere. It just normalizes parenting support.
You want to
And-
mention?
Excuse me?
I was going to say, would you mention how folks who may be seeing this on television will get in touch with, can get
My
involved in
information
Triple P?
is on the back. They can also go to the website and find me.
This website here, triplePparenting.com.
Or they can call the Pitt County Health Department and ask for the parenting person.
Very good. Thank you very much for your presentation and update. Okay, let's move on to Health Director's Report. Dr. Morrow.
Step back down here. There we go. I want to take this opportunity. The communicable disease funding issue had come up through the North Carolina Association of Local Health Directors, and it was actually planned to make a presentation this morning with the Legislative Oversight Committee for DHHS in Raleigh, and I was going to do that presentation, but the presentation got canceled. But I also wanted to bring it here to our Board of Health and let you know exactly what's going on with communicable disease issues. And we just talked a good bit about flu, and that's just one of the communicable disease issues that public health are dealing with. And this pertains not just to Pitt County, but also all local health departments across the state. So over the past 10 years, the number of reportable disease lab reports and cases managed by local health departments has significantly increased. This is the number of communicable disease cases has doubled, and the number of laboratory reports that must be reviewed has increased tenfold over the past 10 years. So I thought this was a significant graph to look at. And I'll explain a little bit of what's caused this. We just talked about our electronic medical record that's coming to the health department. Well, hospitals and private providers and laboratories all have electronic reporting systems today. And so over the last 10 years, we've been able to get those electronic systems connected with public health reporting. I'm going to hold up an antique here for you to see, and some of you probably remember what this is, but that was our public health reporting system. This was from 2004, and the way this got done in the past was in a physician's office when they saw a case of a disease that is reportable by law in North Carolina. They got one of these cards, or their nurse got one of these cards, or someone at the hospital got one of these cards, and they filled it out with the name and the date, and they checked a few boxes, and they checked what disease it was, and they put it in an envelope, and they mailed it to the local health department. We then put that information and sent it to the state health department. Well, that system's gone. And so, and it's gone for a good reason, because we needed a better system. I can tell you, I was in private practice for years before I went to public health. I was terrible at doing this, and every doctor I know was terrible at doing this. You're too busy taking care of the patients, and you forget to send the report in. So we've done some things in the meanwhile. We instituted a 24-hour confidential reporting telephone line here years ago. That was probably 20 years ago when I came. So we've been doing that for some time, but now we have electronic lab reporting. So when Vidant Medical Center, somebody goes into the emergency room and gets a test done, if they do a test that reports one of the 70-something communicable diseases that are required by law to be reported, if that test is positive, say for gonorrhea, that electronic report gets sent to the state laboratory of public health, and that gets reported to the State Division of Epidemiology, and then also gets put into a new system called the North Carolina Electronic Disease Surveillance System that we have access to, so we know that someone in Pitt County who was at the emergency room last night was diagnosed with, say, gonorrhea or salmonella or any of these other reportable diseases. So that's an improvement in terms of our surveillance. So that explains why the number of lab reports has gone up over the last 10 years. And communicable disease cases, of course, if you're doing that testing and the testing's gotten better, the technology for testing has gotten better, it's gotten faster, there's a lot of more point-of-care testing that's available now when you go to a clinic for care. So that's increased the number of cases that get reported. So we're doing a better job of finding cases, if you will, to know that they're even there. The other thing that's increased, though, is outbreaks. So we just talked about influenza, the outbreaks being reported. So we have outbreaks of influenza right now being reported all across the state. but also diseases like pertussis. I got a letter just a few weeks ago from the state about outbreaks of pertussis in Wake County and Henderson and Orange County. They had over 90 outbreak-associated cases from November, going back to November of 2017. So the number of outbreaks that are being reported are also going up. That's good because the improved data reporting allows better disease burden assessment and control. So we can do a better job of taking care of outbreaks of disease and addressing diseases in a community now that we know about them. The control measures for some of these diseases like HIV or hepatitis, we can educate the people so they don't spread those diseases to other people in their family or to other contacts they may have. Disasters can be managed. We can the example I give is when we had Hurricane Floyd. One of our big concerns was our tuberculosis patients. So these TB patients that have TB have to receive directly observed therapy. Well, when Floyd hit, a lot of these people were displaced, and we had to figure out where are they and get them the medication, and just getting there to where they were was a burden. So having these types of electronic systems help us manage those types of situations better than what we used to be able to do. And it helps us in terms of understanding how diseases are transmitted in a community. So that's also been an advantage that's come with better reporting. But I held up that pink card to show you. This is, and I think I gave you all an example of the pertussis sheets that are now filled out. So, you know, we've gone from that one little pink card to this is your basic report information that has to be filled out. But then you have part 2 and part 3 of additional questions. And, I mean, there are a lot of questions on these forms that have to be asked and answered, and somebody's got to do all this work. And that's our public health nurses that do that, our communicable disease nurses. So, you know, a communicable disease nurse in a public health department is not your average nurse that just came out of nursing school like these folks are going to be soon. They're not a nurse that just got pulled off the floor at the hospital. Our CD or communicable disease nurses are extensively trained, and they've got to have a lot of patience and etiquette and knowledge to be able to do this work well. But the other thing I want to mention is that a lot of this work that's done is not reflected in this data, because what I showed you, the graph, was cases of disease. Well, often what we end up with is a positive lab report. We've got to go contact that patient, ask all these questions, just to find out that they're not a case. So we're seeing increased cases, but we're also seeing increased reports that are not cases. And a lot of the work that our communicable disease nurses are doing is for non-cases. So that's gotten more complicated also. So we haven't basically in false alarms, if you want to call them that. We're managing communicable diseases every day in local health departments across the state. And these are just some of the recent case rates. You can see on the left at the top there, you'll notice that Pitt County is a very deep purple. And that's not because of East Carolina, but because our chlamydia rates are more than twice as high of the state average. Unfortunately, we're working on that right now. We have gotten a position, as you well know, in our last budget last year for communicable disease health educator, which we hope to have on board very soon. That'll be helping us address this issue. Pertussis rates, I mentioned the outbreaks in Henderson, Orange, and Wake counties there recently, just in the last few months. This map actually is from 2016. And then the acute hepatitis C rates, we've been talking about the opioid epidemic that's hitting the country, and as you know, hepatitis C rates have increased as more and more people are using IV drug abuse as a result of opioid addiction. So I talked about the number of outbreaks across the state increasing, and this is a map that was done to show how many outbreaks were seen in 2017. You can see there's about 5 or 6 dots in Pitt County. I'll just tell you, these dots are not geographically specific. They're not relevant to any address. They just put them on the map to show that they were in a specific county. They're specific to the county, but not to an address. So I think what this map really shows you is that communicable disease outbreaks occur where population is. You can see dense number of cases in the Charlotte, Mecklenburg area, out in the west around Asheville, Buncombe County, Wake County, the Triad, the Triangle, along I-95 corridor, and then over in the Wilmington area, a lot of dots in those areas. But we have our share right here in Pitt County. So the concern comes here. The funding for local health departments to address these communicable disease issues has been virtually flat for 10 years. You can see it fluctuated just a little above $4 million, went down in about 2011, 12, and then came back up to about where it was in 2007. So if we overlay the number of lab reports increasing and the number of cases increasing, but yet our funding is staying level, you can see where we're running into a problem. And so my address to the Legislative Oversight Committee was, as you can imagine, about changing that formula to get us some more local funding to help address some of these communicable disease issues. There's some counties in North Carolina that don't have a dedicated nurse to do communicable disease work at all. We're fortunate here in Pitt. We have 5 very well-trained nurses that are doing this work, and plus my supervisor and nursing director are both also trained in that area. So if we had to, we could pull 2 more into that group and have 7. But this is an issue that I think that you know, everyone is aware of the recent scares that we've had with Ebola and Zika viruses. Our current flu outbreak this year has already been predicted to cost the United States business and industries billions of dollars this year. We're concerned about novel flu viruses emerging that could be much worse than what we're seeing this year with the H3 flu. We've got the potential for multi-drug resistant organisms like tuberculosis that could threaten our public health. So in my opinion, this is really a matter of national security. Whether we're trying to respond to a naturally occurring outbreak or a bioterrorism attack by a foreign nation, we cannot afford to let our public health communicable disease guard down. We must be well prepared for these events. And there I just put up again the flu incidents. You can imagine if we were dealing with a novel flu virus this year that we didn't have vaccine for, that Tamiflu wasn't effective for, what we potentially could be dealing with in terms of number of hospitalizations and deaths. And it's the public health that's on the front line for those types of events. So I hope you'll help me in supporting the request to our General Assembly for additional public health communicable disease funding moving forward. Thank you, Mr. Chairman.
Very good. Does anybody have any questions for Dr. Morrow?
John, does all the funding for communicable disease come from the state? It's not.
That's a great question. No. A lot of our funding, for instance, our health department is local funding. You saw in our budget report tonight that we've got a substantial fund balance. We're budgeting a lot of that fund balance. We can't afford to do that for very long. So we're using all the funds we can as most efficiently as we can, but the state funds for the communicable disease efforts have been flat. Now, we've had increases, for instance, with Zika, we got a little bit of money from the CDC to help with Zika outreach, to do some mosquito work, that type of thing. When the H1N1 flu, CDC gave some additional funds to help do vaccinations for H1N1 flu. But the state funding has been flat, and that's the one I think that we need to address. But it's not all state funds. That's a good question.
Excuse me. All right. Any other questions? Thank you for a very sobering report there, Dr. Morrow. Do you want to stay up there for the budget calendar items, or?
Yeah, I think I can pull that. I've left my notes over there, but I think I can remember off the top of my head. I just wanted to mention our budget calendar. We will plan to bring our budget back to the Board of Health at the March 13th meeting. We've got our meeting with the county manager for the budget conference on March the 23rd. Also, the budget workshops with the county commissioners. I can't remember exactly when that date is. But typically we're going into May before at least May, maybe even June before the budget is finalized. But y'all will have an opportunity, hopefully next month's meeting, to take a closer look at our budget for next year. So that's the fiscal 18-19 budget starting in July.
All right, very good. Anybody have any questions about the budget calendar? Okay, and then finally, our Board of Health retreat and training coming up this Saturday.
Right, we're looking forward to our retreat Saturday morning at 9 o'clock. I hope everyone can be there for that. We've got 2 guests coming in, one to talk about Medicaid reform. We're scheduled, North Carolina, when I say we, North Carolina is scheduled to have Medicaid reform by July of 2019. A lot of things have to happen between in this next year before we get to July 19. And I would say there's a good chance that may get pushed back some because of that schedule being so tight. But nevertheless, we've got Ron Gaskins, the CEO of Access East Community Care Network here, that's going to come and talk to us about his perspectives on Medicaid reform. And Mr. Al D'Elia from East Carolina University is going to talk about specifically the regional community health needs assessment that will be going on this year, and we'll be participating in that with Vidant Medical Center.
Okay, well, very good. And we look forward to hearing each of the speakers. Does anybody have any other items to discuss? We have a number of students here from East Carolina, nursing students from East Carolina University. Did y'all have any questions for us? Now, don't let Dr. Morris scare you off about going into public health. His 5 crack nurses that do such a great job started out just like y'all did in nursing school.
That's right.
So we hope to see some of y'all in the public health sector in the future. So, okay, any other items to discuss tonight? All right, if not, is there a motion for adjournment? Second. All in favor say aye. Aye. All right, we stand adjourned. Thank you.